Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 1. Shock. Emergency management of shock. Shock is caused by the following etiology. 1. Surgical. 2. Medical. And 3. Trauma. Surgical etiology. Postoperative bleeding, such as ruptured organ or vessel, gastrointestinal bleeding, aortic dissection, vaginal bleeding, and ruptured ectopic pregnancy or ovarian cyst. Medical etiology such as myocardial infarction, dehydration, Addisonian crisis, diabetes insipidus, sepsis, diabetes mellitus, and pulmonary embolus. Trauma etiology. Ruptured or lacerated vessel or organ, for instance, spleen, fractures, spinal injury, and multi-organ injury. And during assessment, you can note the following signs and symptoms: restlessness, confusion, anxiety, feeling of impending doom, decreased level of consciousness, weakness, rapid, weak, thready pulses, dysrhythmias, hypertension, narrowed pulse pressure, cool clammy skin, warm skin in early onset of septic and neurogenic shock, tachypnea, dyspnea, or shallow irregular aspirations, and decreased oxygen saturation, extreme thirst, nausea and vomiting, chills, pallor, cyanosis, obvious hemorrhage or injury, and temperature dysregulation. Interventions. For initial interventions, assess airway, breathing, and circulation. Stabilize cervical spine as appropriate. Administer high-flow 100% oxygen by non-rebreather mask or back valve mask. Anticipate need for intubation and mechanical ventilation. Establish intravenous access with 2 large bore catheters, 14 to 16 gauge, or assist with insertion of central line, and begin fluid resuscitation with crystalloids, for instance, 30 ml per kilogram, repeated until hemodynamic improvement is noted. Draw blood for laboratory studies, for instance, blood cultures, lactate, and white blood cells. Control any external bleeding with direct pressure or pressure dressing. Assess for life-threatening injuries, for instance, cardiac tamponade, liver laceration, tension pneumothorax. Consider vasopressor therapy if hypertension persists after fluid resuscitation. Insert an indwelling bladder catheter and nasogastric tube. Administer antibiotic therapy after blood cultures if sepsis is suspected, and obtain 12-lead ECG and treat dysrhythmias. And as an ongoing monitoring, you should continuously check the following: level of consciousness, vital signs, including pulse oximetry, peripheral pulses, capillary refill, skin color and temperature, respiratory status, heart rate and rhythm, and urine output. And take note of this one. Trendelenburg's position is no longer recommended because of the potential for respiratory compromise caused by pressure from abdominal organs. Kindly click the next button for part 6. Thank you for listening. Have a good day and be safe. Agyamanag.